trial-based versus free-operant procedures. That's what I'm going to be talking about. The term trial-based, that lets us know that this is an opportunity-based teaching method where an instructor-directed SD signals the start of the trial and also signals the availability of reinforcement that's contingent on the child's correct response. So again, responding dependent on the trainer's presentation of the directive or SD. Discrete trial training, DTT, you know that's trial-based because it has the word trial in it. With DTT, we're training in a structured environment at a table. The MOs are contrived because we do a preference assessment to find out what the child will work for. We have systematically planned learning targets, and with each trial, a specific instruction is delivered. That's the SD, with, whatever pre-planned prompts. And when the client emits the correct response, reinforcement is delivered, like praise, an M&M, a small toy. And if they respond incorrectly, well, then a whole error correction routine starts. Incidental teaching, believe it or not, is also a trial-based teaching method, but this one takes place in a free time setting. And instead of systematically planned learning targets like in DTT, the child's initiations are the learning opportunities. And here's where the trial comes in. When the child shows an organic interest in something, they point to it, gesture, or touch the thing, the trial begins. And now they have to interpret the social cue that the trainer delivers. Either the trainer is available for a social interaction, which means reinforcement is available, or they are not, and it is not. So they have an interest, the trial starts, and the adult presents the SD, which is a questioning look, like, I'm looking at you and can I help you look? Now that is the cue for a communicative attempt, and also access to reinforcement is now available. If the child doesn't respond to that SD, well, then verbal prompting is added, do you need help or what do you need? So just like with DTT, responding is dependent on that trainer's presentation of a directive, a prompt, or an SD. Free-operant procedures don't have that trial component. Responding isn't dependent on the trainer's presentation of an SD. In fact, the first free-operant procedure, called free-operant learning method, really doesn't give the trainer much to do. The child is just in an unstructured, free time environment. The SDs are just, part of the natural environment. You see a toy, you play with it, you look for stuff, and just, play freely because it's free time. And when specific, uncontrived yet desired behaviors occur, trainers reinforce those behaviors and record the occurrence of the free-operant instance of a desired behavior. Now, another free-operant procedure is naturalistic teaching. This one also takes place in a free time environment, but here the trainers have some work to do. They aren't establishing SDs, but they are capitalizing on naturally occurring EOs to facilitate functional communication. And if needed, the MOs can also be manipulated, like, putting stuff on high shelves or making things hard to open. Here, the trainer waits for the child to initiate needing help or any sort of request based on something natural that's occurred. I want a treat, I need a spoon, I'm thirsty, I can't find my shoes. And when they make their requests are granted naturally, like in real life. Sometimes it's a yes, and sometimes it's later, and sometimes it's no. And if the child needs help making a request, well, then, of course, prompting is used. So, the takeaway. Trial-based methods. Responding is dependent on a trainer's presentation of a directive, an SD, which means a response is a discriminated operant. And with free-operant methods, responding isn't dependent on a trainer's presentation of a directive, SD. Therefore, a response is a free operant. I hope that helps.